So a PA is a physician associate, which is a new healthcare professional, and we'll be working to help doctors diagnose patients as well. But at the same time, we'll be taking the pressure off nurses too, because we'll be learning a lot of clinical skills.
So prior to this, I've got a degree in biology, and then I worked as a care assistant in an elderly nursing home for a year.
So I've got a degree in biomedical sciences, and then I had a little bit of care experience.
For starting a postgraduate course in physician associate studies, where we do clinical skills training, some training in history taking and anatomy, as well as case-based discussion.
So far we've had a lot of clinical skills sessions, which is every Monday morning, and where we just learn our practical skills. And then we have a lot of case-based discussions as well, where we learn the background of the different diseases, etc.
Taking ECGs, we've been taking bloods, we've been seeing patients ourselves as well. So next year we start rotations of placements, where we are in each rotation for 3 weeks. So we start off with mental health, and then we go into trusts.
Yeah, so we've had primary care placements. We go to the same primary care every Friday. And then we start secondary care placements next year.
At the end of it, I think I'll see how placements go next year, but I'll either look at there are schemes where we go on rotations around trusts and then find an area where we would like to work in that, or there are lots of jobs opening up in general practice as well. It's very intense. It's a lot to take on in a short amount of time. I think a lot of people are shocked at how quickly we're taught things and we move on. So we sort of covered respiratory in 3 weeks, which isn't very long at all. I'm finding it very rewarding.